We now have an opportunity for questions, and we encourage all of you to put questions into Slido. I actually entered one already myself, so maybe we'll start that one off. So I asked, given the high prevalence of APOL1 variants in the African population, do you think it would be warranted to screen at a population level for APOL1 pathogenic variants? You know, is there actual intervention to prevent the end-stage renal disease, kidney disease outcomes if people knew their status in advance?
Yeah, thanks for that question. That is really an active area of research as we speak, including a major program under the H3 Africa initiative and from NIDDK, Kidney Institute at NIH. I think what has come up so far is that if you are about to donate a kidney, that it is important for you to get screened so that if you carry 2 copies of this variant, the likelihood of the kidney remaining, if you donate one, the likelihood of it failing is quite high. So you want to be careful. And also, if you are receiving kidney, you want to know the status of your donor so that the kidney that you're receiving, you want to be sure that at least know the probability of his failing. Sometimes you may actually not have a choice. That may be the only kidney available, but at least you are aware of the fact that this kidney may have come from somebody who carried 2 risk copies of this variant, and therefore the likelihood of failing is high. So at the population level, there is really no recommendation at this time to screen our populations to know who carry these variants. For one thing, we are not quite sure what the preventive strategies are at the present time, but like I said, these are really major areas of study, right now in different African ancestry populations globally.
Terrific. So the next one is wondering how Africa can be included in these GWAS. What do you think should be done?
Again, it's almost always funding. To engage investigators in Africa and other African populations, globally. And H3 Africa has done that. So, for example, H3 Africa right now has enrolled over 100,000 individuals across sub-Saharan Africa that are indeed being genotyped as we speak for various diseases. So those are, at some point, will become part of databases that will be available for doing various genomic work. But again, that is still very small compared to what has happened in European populations. So we need to get additional funding to do much larger studies in these different parts of the world. Like I said in my concluding slide, this message is coming across, and so there's more global awareness. In fact, this meeting that we are having is a clear evidence of that, in terms of diversity, in genomics. So we need to fund more work in different parts of the world, and specifically for these questions across African continent.
Great, maybe we'll take one more question here. The next upvoted question, wanted to say thank you, that's a good one. But one other, did you look at African American genomes with your new African panel? To what extent do African American genomes show mixtures across Africa?
Excellent question. As we know, most, again, the genome of African Americans, about 80% West African ancestry. But there are some evidence that also show that not just West Africa, that there are some admixture that may have come from further down, this is southwest, and also further inland, into almost the borders of East Africa and things like that. So again, I think it's really one of those things that we know is predominantly West Africa, but there are other ancestries that come from other African communities. Yeah.
So Charles, this first one is for you. As well as efforts to increase diversity in genetic studies, are there efforts to increase diversity in clinical trials?
I think there are efforts in both directions. Again, the degree of success is what is really important. Here, like I said earlier during my own talk and the previous, also the panelists, that we are now conscious of this, so there is a push to actually increase diversity, not just in research, but also in clinical trials. Okay.
Great, thank you. And I think panelists should be able to turn on their videos if you'd like to do that. So the next question is for Alice. Is there, or what would be, a reference data set to define data-driven ancestry in order to interoperate various data sets?
Sure, sorry about that. I can't actually share my video because it was turned off by the host.
All right,
so
we'll take care of that.
Happy to. Sure. So, I think it's important to keep in mind that ancestry is always data-driven, right? You can't really determine the ancestry of an individual in isolation. You always have to have a reference panel or something to refer it to, or other individuals in a sample that you can sort of compare that person to look at relative similarities and differences in different genomic regions. So, and that's why estimates of ancestry can change over time and why they're variable in different circumstances, because it's always relative, right? And everything that's actually living on this planet that's made from DNA, if you go back far enough, has some sort of common ancestry in the genetic code. So I think it's just important to keep in mind that when we talk about genetic ancestry in human populations, we're often simplifying it to mean sort of the last, 8 to 10 generations, where we can actually look at those patterns of shared genomic background. But if you go back much further, the concept gets a little bit more complicated.
Thank you, Alice. Next one is for Charles. Should Africa invest in precision medicine? Should this be regional?
Africa should definitely invest, but I think it's a question of time. And our regional perspective, I think, is important. Again, it just depends on what is available in terms of resources. We know that variations also track the regions, and so implementing precision medicine in West Africa may, definitely need to incorporate what we see in terms of diversity there. The same thing in East Africa, for example. But there is a debate about whether that would be the best use of money or resources, in terms of Africa, given again that it's a very limited process. But I think one can make a very strong case that if we do precision medicine correctly, it may indeed help us spread the limited resources in a more efficient way, across Africa. For example, if we are able to use genomics and pharmacogenetics, for example, to better understand who will respond or not respond to a drug, we may be able to actually spread how we use that drug in the population by not wasting it on people who will be ineffective. So I think it is really context dependent and the resources that is available.
Next one is for Consuelo. Where is, oh gosh, they're jumping around. To Giorgio, how do we balance, thank you. Where is the metaphorical low-hanging fruit for increasing diversity in genomics?
I'd say the low-hanging fruit is the diversity that I didn't talk about, and that's the diversity of the research team. I think if we actually have research teams that bring the lived experience of being from racialized minority groups, then it will actually be easier to design studies and think about strategies for engendering trust and recruiting those populations and moving towards actually answering questions that are going to be more relevant to the populations that we most want to include. So I think that's probably low-hanging fruit. There are also other structures in place that I think, we those of us who are in power could actually make this happen. So if we're on the editorial boards of journals and people are publishing their same, findings on non-diverse data sets, then we should be rejecting them. We should be requiring that there are some standards around how we actually do our science. Is it acceptable that we have a publication that's using genetics or genomics in diabetes, and we don't have the people who are most at risk or most known to have diabetes included in the study? I think we should be rejecting that as bad science.
Really great point. All right, so next one is for Giorgio. How do we balance the imperative to have diverse data sets with the potential for discrimination or other harms suffered by the groups?
Well, I think that the real discrimination would be in leaving minorities behind, not including them in genetic studies, genomic studies, leaving them behind in the current situation, which is one of so-called revolution of genomic sciences. And I would invite people to read a beautiful essay written by Dobrzansky in the early 70s. It's entitled Genetic Diversity and Human Equality. The real drive is a civil drive, a drive, a moral drive. That's the way to interpret genetic diversity. But if we do not include populations in what we do, medical genetic studies, in human genetic population studies, we are really doing a great disservice to minorities, and neglecting populations is really a sin. That's my view.
Thank you. Alice, yes, thank you for a great talk. How do people understand ancestry? Is it always as genetic ancestry or something constructed socioculturally?
Thanks for that question. I mean, it definitely depends on the individual, right? Some people think about ancestry as their cultural traditions and their heritage from their ancestors, right? So in biology, we tend to think about ancestry as something genetic. And we asked this question, we actually asked questions of our survey participants that I talked about the types of terms or phrases that might be used to describe all three, race, ethnicity, and ancestry. And the only sort of clear consensus among all of our survey responses for all of the different types of terms and phrases we gave them to choose from, genetic lineage group was said to be by the majority of our participants to be a good descriptor for ancestry. So based on our research, we think that this is, at least the connection is being made between ancestry and genetics for clinical geneticists that we surveyed and researchers. But again, I think the definitions vary and people tend to think about them interchangeably. One sort of example is, we tend to say that a person who looks Black in the United States is a person of African ancestry, or, the person of African descent. Well, we don't really know what that person's actual genetic ancestry is. They might have lots of different ancestral components from all over the world. So to just sort of simplify it and say a person of African descent because it sounds more scientific, we're sort of conflating a racial concept of a phenotype that we're looking at and making a stereotype or an assumption about someone, and then equating that with a genetic concept, which I think is kind of where we get into some trouble. We have to be really clear about what we mean and not equating our observations of a person with their ancestry, which we don't know unless we look at their DNA.
Yeah, again, I just wanted to add a little bit to that. I think we have to distinguish between a colloquial use of a term and a scientific use. Ancestry is genetic. Now, individuals can decide to describe their ancestry based on the history that they know. But if we truly want to understand somebody's ancestry, we need access to the DNA. And we need to be able to put that in the global context in terms of where those different ancestries are from. As we demonstrated, most of us think we know all the sources of our ancestry. We really don't until we actually query the DNA. And that is why you see quite repeatedly on 23andMe ads on TV, people will say, oh, I didn't know that I have that. Oh, I didn't know I have this. is because we have oral stories about what our ancestry is, but it may not necessarily reflect all of the complexity that exists in our genome if we actually do the sequencing or genotyping. Thanks.
Great. And it looks like, I'm not sure if this is Meg, you were saying, is this comment from Anne maybe related? We may miss opportunities if we do not include small populations where protected variants may exist. I'm not sure if that's what you were talking about, Meg, in the chat, but anyway, let's go there to the panelists. I don't think
sorry, I'm not clear. What is the question?
Yeah, I'm not really sure. Let's skip that one. So how about to Consuelo? How do we, as a modern genetic community, distance ourselves from the disturbing racial foundations that our subject has been founded on?
I think it's important to not distance ourselves so much as to acknowledge and change and transform. So yes, it's disturbing. It's really unfortunate. But if we distance ourselves and don't actually address what really has become, in some ways, the foundation, this underpinning of how we make decisions and presumptions that we make about racialized minority groups. So I think if we're really modern, then we're kind of like, the music industry or video, like, yes, we had at some point LPs and, records. Some of you who are younger don't know what I'm talking about, but but now we don't. It's digitized, and so we don't say that that's horrible. It was what we had. It was what we knew. It was, information that was passed on, things built into the structure and rationalized to keep people oppressed. But if we now know better, then it is our responsibility to react and make decisions differently. So how are we designing our research now that we're actually recognizing what race is, and if race is a proxy for racism and discrimination, then are we finding better ways to actually assess racism and discrimination, or those other social factors that are actually at play? If we could actually capture those in a more meaningful way, then perhaps race would be less important, and we could use those social factors and ancestry. But until then, I think we have to find a way to better understand what it actually is that we're measuring and stop conflating those things.
Great, thank you. This next one is to Consuelo and Alice. Is there an effort to engage with the US Census to change the classifications that you mentioned in your talks?
Do you want to go, Alice?
Do you want me to take that? Sure, yeah, there's an entire census committee with demographers and community members and social scientists and others to actually evaluate the census categories. There was a 10-year effort that a lot of different folks were represented on. I don't know if Consuelo knows more about it or wants to add to it, but they worked on it from 2010 for the 2020 census. But since the Office of Management and Budget is in the Executive Office of the President, there's not always a clear transition from the work that's being done by former administrations on the census to the next one. So my understanding is the full recommendations of that committee were not implemented in the 2020 census, but it could be wrong. Consuelo wants to comment.
That's exactly what I understand as well, Alice. And on one of the slides, I showed a single question for race and ethnicity that's combined. Those are the questions. That's the way that we ask about race and ancestry and the All of Us research program, the Precision Medicine Initiative. So there's a single question. It does not say what is your race or what is your ethnicity. It says, which of these best describes you, and it gives a list of you know, what traditionally in the United States, based on the census, has been race, but also it includes Hispanic ethnicity, and it adds actually in another category that's not in those Office of the OMB categories, and that's Middle Eastern, North African, and an individual can check as many of those as they'd like. And then once they identify those, it actually branches to a more granular ethnicity. So if you identify as Asian, you can then identify as Japanese. If you identify as African or African American, then you can identify as Nigerian or Haitian. And so it is a more granular way of collecting that data, and it was completely based off this committee that Alice just mentioned, which was a census committee that did lots of testing. The single question actually had fewer missing responses. So a lot of people in the United States who identify as Hispanic or Latino or Latinx did not necessarily identify a race. And so there was a lot of missing data there. People who are more recently immigrants into the United States didn't identify it with a race, period. And so that single question had captured more information. But as Alice mentioned, this was in 2016 when we were making decisions, and we presumed that the census was actually going to use this single question, but that didn't happen with the change in administration.
I actually think that this is one example of why it's so important not to distance ourselves, just to echo what Consuelo was saying earlier, because if we don't understand the history of how we arrived at the categories that we're currently using, I think we fall into an assumption that they're somehow valid by inheritance, that just there's this inertia behind the systems and the frameworks that we have already. So, but we have this practice, I think, in science of calling anything that we know now to be wrong pseudoscience from the past. Oh, well, that was pseudoscience and that was crazy, but what we're doing now is really rigorous and accurate and objective. And I think that sort of othering of the past and calling it something other than what it was, which was at the time cutting edge science, we miss an opportunity to see what we're doing now that might in the future be called pseudoscience. And probably some of that falls in this area of race and ethnicity, using that as a proxy for genetic ancestry. As our populations get more and more diverse with more migration, et cetera, that's going to be increasingly true. So it's just really important to echo that point, that we actually study and understand the foundations of our field and acknowledge them so that we can repair the harms and actually move forward and make sure that what we're doing now is really, it's really cutting edge for today and not just an inheritance based on something from the past that was not as scientific.
Okay, so I think we have time for one more question. We'll take this one at the top. Does H3, to Charles, does H3 Africa have its own customized chip? And if yes, is it in use? If not, are there plans to develop one?
Yeah, I'm really, really glad somebody asked this question. Again, it's a wonderful opportunity to highlight the resounding success that H3 Africa has been. Yes, H3 Africa has its own GWAS array, its own GWAS chip that has about 2.5 million markers. There was a joint effort between H3 Africa and Illumina to create this GWAS chip. It's currently being used to genotype, I'll say as of last check, probably over 70,000 Africans. It's really been shown to be more effective and more efficient in interrogating African genomes, because it was designed by sequencing different African populations, including those that were not part of the 1,000 genome or HapMap or current publicly available databases. So it really does include quite a bit of variation that will help us to study African populations, quite effectively. So we are quite happy about that development.